So we are going to be talking about thermography today, and if you've never heard about it, you will have an education like never before about thermography. So my name is Jacky Groenewegen. I'm a certified thermographic technician. I'm certified by the Professional Academy of Clinical Thermology. I'm also a professional member of Breast Thermography International, as well as being a licensed massage therapist. So I am the person that you would come to see to get your scan done. I'm the technician. I take the images and then I send them off to our doctors. And all our reports are reviewed by 3 interpreters. The last doctor to review all of the scans actually is Dr. Alexander Sepper. Now he's been a gynecologist for over 30 years and he has literally performed hundreds of thousands of thermal studies for women with ovarian and breast cancer. And he has a PhD in thermology. I mean, it just doesn't get any better. So what is thermography? What it does is it measures heat through the use of an infrared or thermal camera. It's been FDA cleared since 1982. It's state-of-the-art technology. It's radiation-free. And what it does is it visualizes changes in the body or targeted areas like the breast that can be indicative of dysfunction, disease, or cancer. So let's talk about the history of thermography. And what we see here is it started way back with Hippocrates in 460 BC. And you can see the history of it all the way through 1982 when it became FDA cleared as an adjunctive screening for breast cancer detection. So how did Hippocrates come across this? So as a physician, what he did, he would take mud or clay and spread it over the part of the body of concern, and he would watch to see where it dried first, because that would indicate that that was the hottest place, which would correlate to inflammation. So it was brilliant that he came up with that. There are so many different applications for thermography. The military uses it, night vision cameras. You will start to see more and more large public buildings and airports often have thermal cameras. And what it's doing is they're monitoring the people that walk by, and they're just taking a quick shot of their forehead to see if they have a fever or not. And then in that lower slide there, you can see that is the image that was taken when they captured the Boston bomber. Remember, he's in that sailboat in someone's backyard, and you can see the outline of him, and that was picked up by a thermal camera as well. Let's talk about the difference between thermography and mammography. What is the difference? 1 in 8 women in the United States will develop breast cancer in her lifetime. 26% of breast cancer cases occur before the age of 50. It's estimated in 2020, 276,480 will be diagnosed with breast cancer, and that's 15% of all breast cancer cases. It's also estimated that in 2020, over 41,000 deaths from breast cancer, which is 7% of all cancers. And by 2030, 26.4 million new cases of breast cancer and 17 million deaths. There also will be 2,620 men diagnosed. That rate with breast cancer usually is 1% of the overall breast cancer cases. What we see here is a phenomenon called angioneogenesis. And we can see those 3, thank you. We can see those 3 tumors. The one on the upper left, there's that tumor, how it starts out. It's attached to a blood vessel. Then over time, all these little blood vessels become attached to it, and that's when it becomes vascular. Once it becomes vascular, then it starts to be being fed by those blood vessels. And then in the one on the right, you can see that now it's just growing at an explosive rate. It's become very vascular, and that's how it spreads as well. You can see it going into the bloodstream to create new tumors. Dr. Christine Horner, who is a plastic surgeon and activist for the prevention of breast cancer and is regarded as expert on breast cancer, this is what she says. Before a breast tumor forms, new blood vessels will start to grow in the area, but they aren't normal blood vessels. They grow in abnormal patterns and produce abnormal amount of heat. Thermograms are safe, harmless infrared pictures of the breast that can pick up these abnormal blood vessels and heat patterns as early as 5 to 10 years before a tumor grows to the point where it can be detected by a mammogram, MRI, ultrasound, or even felt by physical examination. Here we have an image of 4 different types of breast screening. So the upper left, we see mammogram, and the mammogram is going to create an image of the internal structure of the breast using x-rays. The lower left is an ultrasound, and it's going to get that image with the use of high-frequency sound waves. Upper right is an MRI, and that creates the image using magnets and sound waves. And then, of course, thermography on the bottom right creates that image of the breast under the armpits and using the thermal camera. There are over 4,000 articles published on thermography and over 800 peer-reviewed articles on breast thermography. There's other studies on cerebral vascular disease, skin cancer, heart disease, neuromuscular, diabetic neuropathy, thyroid, and more. Let's talk about breast thermography. It is safe and comfortable. There's no contact, no compression, no radiation. It helps to identify around 95% of the early stages of cancer in a multimodal approach. It's effective for all breast types and sizes, including dense breasts and breast implants. Images are taken of the breast, the chest, the breast, and under the arms. It's appropriate for women of any age and can provide the first signal that an underlying problem is developing. So things that you should know about thermography. It's useful for younger women, 20 to 50, who has dense breast tissue, and can make it harder to detect via mammograms. So in 2014, there was a dense breast tissue law enacted. Many states have this law. What it basically means is that when a woman goes for a mammogram and the radiologist deems that she has dense breast tissue, then she needs to be notified that a regular mammogram may not be effective for her, and they'll probably recommend a 3D mammogram. So you got to think about it this way. If she's got dense breast tissue and a mammogram is looking for already established densities, that can make it challenging to find something that shouldn't be there in a mammogram. And then the other thing to think about too is younger women, 20 to 50, you think about the standard of care, which says that mammogram screening should, depending on their medical history, should start somewhere between 40 and 50. Well, what is the screening then for those younger women? Because unfortunately there are plenty of other breast cancers, aggressive ones, that happen in younger women. So that's problematic. So who else can benefit? Would be women who are unable to undergo routine mammography for a host of reasons. And there's a higher survival rate when you detect signs of disease at an early stage. It is a well-known fact that if treated in the earliest stages, a 95% cure rate is achieved. And here it says the cure is early detection, but let's take that one step further and say the cure is prevention. And here's a slide about the radiation exposure from a mammogram, and the 3D mammograms have more radiation than the regular mammogram. So this is moving on now to talking about breast health assessment. Toxins and excessive hormones create increased heat in the breast, and thermography monitors heat. So you are looking at exactly the same image. On the left, you're seeing the color palette. On the right, you're seeing the grayscale. So on the left and the color, you're looking at heat patterns. So red is hot. Under the arms and the crook of the neck, under the breast is hot. It's normal, perfectly normal. But if you look in her right breast, so on your left, you can see there's an abnormal heat pattern there. That's actually a tumor. Now, if you look at the grayscale image beside it, where the circle is the circle around that area, you can see those suspicious vascular patterns. So those blood vessels are leading directly to and from that tumor, and so it's metastasized, it has spread. Here we can see the dangers of a mammogram's pressure on implanted breasts. So many women are concerned about the pressure from mammography on natural as well as artificial breasts. The left breast on your right was ruptured by the implant, not the breast, was ruptured by the compression from a mammogram. Many women choose not to get annual screening due to their concern from mammogram with implants. Thermography uses no compression and is completely radiation free. So if you can see that little arrow, and that's the saline that has leaked out of that implant. So now we are looking at images of cancer advancing. The two on the left-hand side are the same image in color palette and grayscale, and then the two on the right belong together, and they are 6 months apart. And it's easy to see how, on the right, how much it has progressed so quickly. Here we have an image of inflammatory breast cancer. This patient decided to try alternative treatment and not consult with a breast surgeon for mastectomy as recommended by our doctors. She started out with breast and nipple itching. The ultrasound was inconclusive. She went to Spain for cancer treatment, and it continued to get worse, and she passed away, unfortunately. So in thermography, we talk about bras a lot. And look at what a tight bra can do. This happens every day with most women. Most bras are way too tight. The support either comes from the top of the shoulder or the band around the chest, and almost always it's too tight. And I know breast bra stores, etc., would disagree with me, but I mean, a thermal camera doesn't lie. You can see the outline of the bra, and this was 15 minutes after she took it off. And all that cloudy red stuff in between bra straps, that's lymphatic congestion. So she's wearing her bra 18 hours a day, 7 days a week, most of her life, and she is completely jeopardizing the health of her immune system because it acts like a tourniquet, cutting off blood and lymph all day long. So a trick, when you take your bra off, look to see anywhere on your body if there are red marks or divots. And if there are, it's just too tight. It's just cutting off all of those fluids that your body needs. So it's hard to find a really good bra. I know that. I don't have any answers because I haven't found the perfect one for me either. Right now, what I'm doing is wearing sports bras that are way too big so that it's as loose as possible, giving me enough support that I feel I can go out in public with it. So another example of a bra that is too tight. Look at that inflammation in those four breasts, and that's going on all day, every day. So take the bra off when you get home. Wear it as little as possible. Massage your breasts every time you take your bra off. Massage the breasts, the chest, under the arms. And if you feel a warm, tingly feeling in your breasts, that's blood rushing back into your starving breasts. There are so many other applications and ways to lead to diagnoses with thermography, and there's a list of them, just so many things. You start out with, and I'm going to run through them for you, but it starts at the top of the head all the way down to the bottom of the body, which the doctors can discern and suggest clinical correlation or further investigation. Just like any other test, mammogram, MRI, ultrasound, thermography, they are diagnostic tests. They do not provide a diagnosis. Dental issues. Well, we've all heard that correlation between gingivitis and heart disease. That's very true. That's very true, but it's much more than that. Now let's look at that upper right picture of that woman. The darkness around her mouth, that's oral inflammation. If you look at those little green arrows, we can see that the infection that she has, that bacteria, is dripping down lymphatic channels. And in her case, in the picture on the left, you can see that it's going directly into her breast. So when we see that someone has oral inflammation, which is almost always, we will send them to their dentist. Sometimes that inflammation has not yet broken through the gums, so the gums could actually still look pristine. But again, I will tell you, a thermal camera does not lie. It's just a matter of time before that inflammation reaches the surface of the skin. So it's so key to monitor your oral inflammation, because we've heard many times holistic doctors saying that 80% of disease starts in the mouth. The other thing that we have at BTI, Breast Thermography International, we have a consultant who will do consults specifically on oral inflammation, which has helped so many people. Here we have an image of periodontal disease, and you can see the progression, 1, 2, 3, 4, and that's pretty, it's a good animation, a picture rather. So chronic inflammatory disease affects the gingiva and bone that supports the teeth. Over 42% of adults over 30 have some form of periodontal disease, and more men than women have it. It's an epidemic. So most people have some form of it. This is a picture of a healthy mouth. This is not a healthy mouth. Severe periodontitis. You can see all the red that's going down the neck and around the mouth. A very unhappy oral cavity and the neck. It's all full of inflammation, bacteria, infection, who knows. Another image with dental inflammation, oral rather, and this is draining into the supraclavicular lymph node. I know, that's really, okay, thyroid dysfunction. The thyroid, when we have that oral inflammation and it dripping down, like I said before, then it can go right to the thyroid, and that is going to marinate the thyroid, bathing it in toxic, acidic junk. And no matter what you do to try to address an unbalanced thyroid, it's not going to be happy, it's not going to heal until that oral inflammation is addressed. Here we have a great image of oral inflammation resulting from a post-root canal. So this person had no symptoms. There was nothing bothering her. She just had a routine scan, and you can see on the left picture by the bottom of her jaw, all that inflammation there and infected. It's an infected root canal. Again, she had no idea that that was there. Root canals are not, you will never see a holistic dentist perform a root canal. They are not a healthy choice. If you need more information about that, let us know. This is an image of a gentleman, and he kept his mustache, his facial hair on, so that's what that black stuff is. What we are looking at here is a cerebral vascular screening. What we should see on both sides of the forehead is 2 vibrant blood vessels. So the one on the right looks somewhat normal, the number 2. The number 1, that is that's a total blockage there. So when we're doing thermography, we're looking for heat patterns or lack of heat. In that case, there's no heat. That means there's nothing in that artery. So that means there's a blockage. So unfortunately, this gentleman passed away from a stroke 3 weeks later, I believe. So this can be hard to make out what we're looking at. This is the left side of her face. The red area is her ear and upper jaw area. Stress, dental work, and braces can alter the structures of the face and skull, leading to improper biomechanics and resulting inflammation. Dentists are beginning to use this technology to see the results of their work, and we perform this check as well in our scans. This is a picture of melanoma. So she came in for her screening, and this was found. If you looked at the skin of her back, it looked completely normal, but this was what was detected, and that was a melanoma. Severe inflammation can be picked up in many parts of the body, and sometimes they follow a path, like you see in the gentleman on the right, and on the lady on the left underneath her breast. That's where the liver is. And so obviously she's got a very unhappy liver there, and that needs further clinical correlation and or investigation. Chiropractors love using thermography. This is a 12-week increment treatment plan, and it's remarkable to see what her posture was like and how much inflammation she had, and then in the bottom right, how much it was improved. Pretty incredible. This lady came in for a breast scan, and she had a little bump on her cheek, and she says, "I'm pretty sure that's a spider bite, but it's pretty much gone now." So I'm doing this scan, and I see that long, because I'm scanning her chest, and then I see that long line of heat there and going, "What's that?" So I panned up and saw what the effect of the venom was having on this lady. And she had no idea. Well, how would she, right? So when she saw that, she was pretty surprised and got pretty aggressive in trying to treat that. I think she went to her functional medicine doctor for that too. Tracking treatment progress. This is a great way to track cancer treatments. And this was a pretty remarkable case. In the span of 2 months, you can see from the upper left, all going to the right, and then on the bottom one there, it's just like disappearing by the hour, and thermography tracked that for her. So she knew, without a doubt, that this treatment plan that she was on was working for her. So sometimes they're not working for them. So that's important. If it stopped getting better, then her treatment should change, right? We know this one was perfect for her. The two upper images go together and the two bottom images go together. So this is a picture of hormone imbalance. All that modeling and those leopard spots are indicative of hormone imbalance. And then she went into lifestyle changes and working on improving her hormone balance, and look at the change. Now when this is a good time to show in the lower left, you're saying, well, what are all those blood vessels? That's normal, and they're symmetrical. That's a good thing. Another example of monitoring lifestyle changes, with the top belong together and the two in the bottom belong together. Incredible changes. And the befores and afters of lifestyle changes as well. Pretty dramatic. So a full body scan costs $499. The head and torso screening, which is everything except the arms and the legs, is $329. Breast screening is $249, and children under 16 are $129. Those are the different types of screenings that we provide. And we always recommend that women get more than just the breast screening for a couple of reasons. Number one, we are more than our breasts. And if you bump it up at least to the head and torso, then we get a much better idea of the global inflammatory load, and it works better for overall baseline too. After you get the results of your scan, then we encourage everyone to have a 15-minute consultation with Dr. Piana. It's a telephone call. He's going to go over your entire scan with you. He's going to tell you exactly what's going on in your body, thermographically speaking, if there are any concerns, and what your next steps could be. So after that happens, what you need to do is take those results to your wellness team and let them come up with a treatment plan specific to what's going on in your body. That's what the whole purpose of this is. This is where you start. You get your scan, you see where you are, and then you go out to your wellness team and get started on your treatment plan. We do have a referral program. So if you refer one person, you get $25 off your next screening. There are no limits. You can refer 10 people and get your screen pretty much paid for. Please like us on Facebook so that we can share new cancer studies, articles, and events from Mindful Wellness Medical Thermography. And go ahead and take your camera, take a screenshot of that so you have my phone number so you don't lose it, because I want you to call and book your scan, and I would happy to chat with you before you do that so we can make sure you're comfortable with the choices that you're going to make.